So as we begin to speak more about telehealth, I want to make sure we familiarize ourselves with the common terminology used in the field. And many of the terms sound familiar. They all start with tele, right, often, but there's some key differences that are important to note. So let's take a look at some of those examples. A lot of times the terms telehealth, telemedicine, telemental health, telebehavioral health are used interchangeably, but there's some important differences to consider. So in general, telehealth is defined as the use of electronic information and telecommunications to support and promote long-distance clinical health care, health-related education, public health, and health administration. So in short, it's any health service that uses technology to support and promote care, education, awareness, and administration. So it's not just this direct service. There's some other elements to this broader definition of telehealth. So, and some of the telehealth technologies include, but aren't limited to, video conferencing, store and forward imaging, streaming media, both terrestrial and wireless communications. And so, again, we know the prefix tele just means distance. Then the suffix is the thing to attend to. So telehealth is the broadest umbrella term. And then telemedicine typically refers to the practice of medicine. Telepsychology refers to the practice of psychologists, so on and so forth. The end will tell you kind of what discipline you're generally talking about. And then within that discipline, it may be direct service, it may be related to education, it may be related to administration, but you're using technology to do that. So as the telehealth field continues to grow, more domains will develop under the umbrella of the bigger term telehealth. So the rest of this PowerPoint will use the term telehealth because the information in this training shouldn't be specific to any one health discipline. It's really just to give you a basic understanding of telehealth. In our next section, we're going to describe 4 modalities of telehealth: real-time, store and forward, remote monitoring, and mHealth. Of these 4 modalities, some are synchronous and some are asynchronous. So the term real-time describes synchronous care, which is care that's occurring instantly between the provider and patient. This communication allows for immediate feedback, interventions, follow-up questions. It's good for crisis intervention and live consultation. It's often provided in telepsychology, telepsychiatry, telehome care, and telecardiology. Store and forward is asynchronous. So again, synchronous happening immediately following. Asynchronous, there's these breaks in communication where the patient and the provider are not communicating in real time. They may be leaving messages, could be email, could be text, could be delayed video or images that are being reviewed. So this form of communication is beneficial in certain scenarios. And also just some types of healthcare are best served from this modality. So radiology has been doing this for a long time, of reviewing images from a distance. So that's an asynchronous mode of telehealth. Remote monitoring uses sensors to collect data from the patient and will immediately provide that data to the provider, or it can. This happens as symptoms are occurring, so it can be a useful tool for providers to collect specific data which otherwise may not be expressed verbally. This is commonly used in medical fields with new technology and advancements in the field of neurology and biofeedback. Remote monitoring is showing increased presence in the behavioral health realm as well. But one of the times we see this most often is in tele-ICU monitoring, where you can have larger hospital systems and specialists who are reviewing data that's being remotely monitored maybe at smaller hospitals. So lastly, the fourth is mHealth, and it's a new and rapidly growing modality of telehealth. That's specific. When someone says mHealth, they're specifically talking about mobile health. So a mobile device, a smartwatch, a mobile phone, and what health care and monitoring is available through your mobile device. So there's a little bit of overlap with the other 3, because you could be doing live video feed on your mobile device. That would qualify as mHealth. or you could be maybe monitoring symptoms through your phone. So there's a little bit of overlap, but now general consensus that that's the fourth category. So now that we know that the four modalities of telehealth and we understand the difference between synchronous and asynchronous care, let's pause to make sure you have a mastery of the term face-to-face and how it relates to in-person care. This is one of my personal soapboxes because I see that the mistakes that are being made in this terminology really are affecting our policies and legislation. And if we all can get on the same page to use the terms correctly, we'll be in a better boat. So treatment that is done in person is a medium of health service delivery, but in-person treatment isn't telehealth. In-person treatment is when the provider and the patient are present together for treatment, so the provider could physically reach out and touch the patient. And then face-to-face just describes any treatment where the provider and the patient see each other's faces. So face-to-face could be in person, but face-to-face also can be a telehealth medium. So again, it's crucial that we're using those words correctly. So in-person service is face-to-face, but telehealth service can also be face-to-face when there's a live video feed between two people. And there's so many HIPAA-compliant solutions for video conferencing that allow providers to see patients from a distance for treatment while keeping the data encrypted and secure. Phone sessions may also be offered as an option, and so that would not be face-to-face, but it would be synchronous care. It may be useful when the patient or client is in crisis. This will often happen both in medical and behavioral care settings. Clients and patients call when they need something, and that is, in essence, a form of telehealth. Phone can also be important when there's it's a way to maintain consistency in treatment when distance or disability or transportation costs may be an issue. So whether you're bringing the service into someone's home or a location outside a staffed organization or to a clinic via phone or video conferencing, there are special considerations for handling emergency situations, and we have an additional training that will explore those topics for the behavioral health realm. Actually, the Veterans Administration and the Department of Defense are the ones at the forefront of home service delivery, but this is advancing. There has historically been some reimbursement issues that in-home care was non-reimbursable or limited reimbursement through Medicaid and private insurance, but as telehealth advances, those reimbursement policies will change quickly as well. So there's other mediums to treatment, such as email, text messages, and voicemail, and those are all useful tools to inform patients about treatment. Some providers will use these mediums to remind patients about their upcoming appointments. That's telehealth. Others use these as a form of service delivery, like text and email therapy. So it's important to recognize the limitations of the mediums in the asynchronous world because they're delayed and sometimes unreliable. There's also no way to make sure that the patient is receiving the message. So it's just important to think about how to protect that information and what types of services that you would want to do through an asynchronous modality.